Hi, my name is Vivian, and I am your host for today's episode of Recovery Mode. Today, we are discussing the transition into home life after a life-altering diagnosis and the need for occupational therapy services in this realm. According to the CDC, in 2019, there were 15 leading causes of death in the United States for adults. For the sake of this short podcast, I will only go over 7. In order, these conditions are heart disease, cancers, unintentional injuries or accidents, chronic lower respiratory diseases, cerebrovascular diseases or stroke, Alzheimer's disease, and diabetes mellitus. For the pediatric population, the top 2 conditions are unintentional injuries or accidents and cancers. I think we can agree that all the listed diseases are not conditions in which you can just be prescribed a course of medication, comply with the dosage, and be done. No, the ramifications of these conditions linger for many years to come and hinder the lives of not just those primarily affected. It goes beyond them and it alters the health and mental status of their parents, children, and eventually everyone around them. According to Johns Hopkins Medicine, the trajectory of a hospital stay is the incident, emergency department, admission, and then discharge to another facility or home, depending on medical stability. My colleagues and I have been discussing the need for occupational therapy services in this area. Today, we have 2 guests, Mia and Chelsea, who will share their knowledge about implementing a transitional care program and also their personal experiences with this topic. Let's turn it over to Chelsea, who will explain the role of OTs in this area of practice.
Thank you, Vivian. I'm excited to talk about the practice of transition care for OTs to implement it, as it will be unique and complex for each client that is receiving services. As a patient or client, experiencing a life-altering diagnosis may leave them feeling hopeless and unsure how to utilize resources. The transition care program will allow OTs to work closely with their client to create a plan for their continuum of care through each setting, especially when discharged home. It's important to note that the healthcare system lacks transition care, especially after a life-changing diagnosis. With transition care as a potential practice area for OTs, more specialized care can be implemented to ensure that their client is able to adjust to a new normal, physically, mentally, and emotionally. Implementing the transition care program with OTs may consist of a needs assessment, helping with environmental modifications, addressing the client's mental health and different coping mechanisms, educating the caregiver and family members, and ensuring the client is not regressing with the recovery process. With the creation of a transition care program, we are hopeful that OTs can help to improve the lives of clients when faced with a life-changing diagnosis.
Thank you, Chelsea. Let's turn over to Mia, who was just 17 years old when she was involved in a motor vehicle accident. This incident would change her life for many years to come. Hi, Mia. Can you tell us a little bit about this incident?
Yes, Vivian, thank you so much for the introduction. 8 years ago, I was T-boned by a driver high on pain meds. He hit me directly on the driver's side and I was pushed 50 to 60 feet into a cement wall. I was knocked unconscious immediately and was life-flighted to the University of Utah Hospital. From the accident, I had sustained 3 severe traumatic brain injuries, a shattered pelvis, a broken collarbone, 4 broken ribs on the left side, my left lung was collapsed, and I had bleeding in my lungs and in my brain. My spleen was also ruptured. Arriving at the hospital, I was rushed into emergency surgery to take out my spleen and to control all of the internal bleeding. I was in a coma for 17 days, and while in my coma, I had many strokes due to the blockage of blood flow through my carotid artery. My prognosis was bleak, and the doctors assumed I would never recover, but I worked hard in therapy, and I'm proud of where I am now.
Wow. It sounds like you had a lot of support while in the hospital. Do you feel that this was the case after you left?
While I was at the hospital, I was watched like a hawk, and all of my questions were answered. I didn't feel disabled until I went home and realized I was very different. I was in a wheelchair, I had trouble with memory and problem solving, and didn't realize how important it was to take care of my mental health until years down the road. My parents and I felt lost.
Can you name maybe 2 or 3 things that you were not able to do after the accident?
Yes, definitely. For starters, I was in a wheelchair while my pelvis healed. I was homeschooled the first half of my senior year. I was unable to eat real food because of the possibility of aspiration. I had difficulties in school due to my brain injuries, and sadly, I had to give up a soccer scholarship to a university in Utah. My entire life, I was known as the soccer girl, and my accident took that from me in an instant. I missed out on a lot of experiences most teens should have.
Do you think you could have benefited from a transitional recovery program?
It's crazy, but 8 years later, my parents and I still talk about how we wish we would have had something like a transitional recovery program. I think it would have saved us a lot of future heartache if I was given more resources and had been treated more holistically.
Wow. Thank you, Mia, for your story. Speaking about caregivers and caregiver burden, we are going to turn it over to Chelsea. Our second guest, Chelsea, was 24 when her father's spinal injury did not go as anyone would have hoped.
Thank you, Vivian. After a life-changing diagnosis, clients will rely on their supporting environment to aid in the recovery process during this new transition. As an OT, educating the family and loved ones about the recovery process is just as important as educating the client. A topic that is commonly overlooked in the recovery process is caregiver burden and education. A life-changing diagnosis can be just as impactful for the caregiver as it is for the client. When a loved one chooses to be a caregiver, OTs must also consider the mental and physical well-being of the caregiver along with the client. A study published in the British Journal of Occupational Therapy noted that decreased participation in valued activities can lead to occupational loss, which is associated with increased perceived burden, poorer mental health, and lower vitality for female caregivers. During the transition care program, it will be important for caregivers to remain informed through each step and to ensure that well-being is being addressed as well. I could relate personally to the process of being a caregiver and experiencing caregiver burden, as my mom became my dad's caregiver after a spinal surgery that left my dad with impaired abilities. After a mistake that happened with my dad's surgery, it was extremely difficult for my dad to cope with a new normal, as he described it. Things changed drastically for both my mom and dad as they tried to work together as a team and realized they had to make big changes to accommodate for my dad. I could see how rough things have been for my mom, as she had to retire early to take care of my dad. Very little services were offered for my dad after he left inpatient rehab. With such a big life change, my parents were given little direction on how to acclimate to the changes they both endured, both physically and mentally. With the implementation of a transition care program after this life-changing event for my dad, my parents could have utilized more resources and experienced a smoother transition after this unexpected change. As an OT can be utilized to work with the caregiver for education on the transition process and also ensure that the caregiver is being taken care of both physically and mentally.
Thanks, Chels. Now let's turn it over to Mia to talk about the socio-political influence.
Thanks, Vivian. All in all, a transitional care program could decrease readmission rates. One research study conducted by Fredberger noted that by improving transitions in care, occupational therapists can have an impact on reducing hospital length of stay, spending, and readmission rates. This in turn decreases the amount hospitals are required to pay. With transition programs, everyone wins.
So as we have heard, multiple services are offered to patients in the hospital setting. However, once medically stable, the majority of those services do not follow the patient. A transition care program after a life-altering diagnosis or incident is necessary to reintegrate back to the normal life this patient once had. According to the OTPF, OTs work with patients to enhance their performance and participation in everyday activities. They do this through creating opportunities that account for all clients' factors and modifying tasks and activities for successful performance. They teach their patients to utilize their preserved skills, and whether it's through the introduction of a medical device or lessening the activity demands, support is there to keep the clients engaged and prevent further disability. Thank you for joining us on this episode of Recovery Mode, and a special thanks to our guests for sharing their impactful stories.